Welcome back, listeners, to Mosaic's Community Life Podcast, Life in Canada, episode 23, and Happy New Year to those that are online. Thank you for taking the time to listen to our podcast today. My name is Jane Teasdale, and I'm one of the co-owners of Mosaic Home Care and Community Resource Center. Our organization focuses on person-centered care, social connection, and community. Today, I would like to introduce our client services team. They are the engine of our company that keeps things moving along within Mosaic. And it's not all the time that I get to interview our client services, because they're busy, with dealing with some of our families, our clients, and also our personal support workers. So I'm so happy that we were able to do this. So I think what I'm going to do is introduce everybody and sort of give a brief synopsis of what everybody does at Mosaic. So those people listening have a good idea what I guess makes Mosaic stand out from other home care organizations. So first is Candace. Candace is our team lead. Hi, Candy. Thank you for coming online. And Candace is responsible for client care coordination and the primary team supporting the core process. So this could be admin support, dealing with our client services, families, also knowing about resources in the community and so forth. As we know, client care coordination is heavily a process intensive with a heavy workload, and the team lead is the key cog in the client services department. The team lead is a senior active care coordinator in the team and represents an important link between an active care coordination and the senior manager of client services. The team lead is an important member of the team that processes many functions to also include dealing with complex clients and working within the team as a true integrated model. In 2018, Candace completed the McMaster Certificate Program, which provided the tools to be able to deal with more complex issues going forward and to implement a more person-centered approach to care. Next, I would like to introduce Martha Miller. And Martha Miller has been with Mosaic probably for well over 13, 14 years now. So we're happy to have her on the line. She works very closely with me on the person-centered training. She also came with me to the UK to one of the conferences of the European Society for Person-Centered Healthcare. So her role and position helps maintain positive relationships and overall high standards of care that our clients deserve, with a focus on person-centeredness within the home care model and framework. Her role provides support and guidance to caregivers in delicate assignments. Ongoing home visits are conducted to get feedback from employees, clients, families, or representatives. Next, hi Karen. I'd like to introduce Karen Terrell, and Karen is our RPN Client Services Nurse Consultant. She works on the end-of-life training, provides additional training for our frontline teams as needed, communicates with families, clients, and frontline teams on any medical issues that need attention. Her experience in caring for our clients, as well having gone through some of the challenges working in the front line, has helped in building a better partnership with caregivers, clients, and our community partners. Karen also visits clients and educates our personal support workers and nurses out in the field. She is also very experienced in palliative and end-of-life care, falls prevention, and personhood as well. Next, I'd like to introduce Diane Roberts. She has a BA in psychology, and she works in the client services department. She's experienced in grief counseling, end-of-life care, has attended with me and presented on person-centeredness at end-of-life at the Palliative Care Conference in 2024. In 2018, Diane has taken courses on dementia care, training through Alzheimer's Society of Toronto, attended several seminars and workshops on grief and bereavement through PalCare. In 2018, Diane updated her education by taking the dementia care training program through the Alzheimer's Society of Toronto. Grief and bereavement support two-part seminar hosted by PalCare. and specific focus on supporting those who deal with grief in the workplace, both caring for caregivers and persons within grief. Diane and Karen are working collaboratively in running workshops for our frontline caregivers on person-centeredness, palliative and end-of-life care workshops hosted at our community hub at our Mosaic offices in Toronto. And lastly, I'd like to introduce Nikita. Hi, Nikita. Nikita is a BSW, RSW, and works in client services, family social worker consultant. I would like to also comment that many private home care organizations, to include private and franchise operations, do not have a social worker. So really, within Mosaic, this really stands out in really providing an integrated approach with social work and also sort of that combination of nursing and social work as well. Myself and my business partner, we thought that this was an integral role that we needed to add to Mosaic. That has really helped Mosaic because we're dealing with very complex cases out in the community, working with families. So we really need to have that care navigation component. And really the whole team, I must say, of client services with their expertise, they all have something different to bring to Mosaic, and definitely the social work and nursing is part of that. Nikita works and implements at the micro model of social work, which is a level of social work that involves working with individual clients or families to help them overcome challenges and provide other resources and information where needed. I would also like to mention our other staff because they are also doing a lot of the work on the back end, usually on the weekends, after hours, and that is Cleonice, Alicia, and Janessa. And so we thought that that was important rather than using an on-call service where a family would just be calling and saying, okay, I need some assistance. This way, our client services, they all work on a collaborative approach. Everything is entered into our system. So everybody is familiar with our clients and with our families and are able to troubleshoot and give answers or resources or help. So this is one thing, too, that I would say stands out with what Mosaic offers. Our client services is a team of care managers that seamlessly work together to support our clients and caregivers 7 days a week. Each team member has received an in-depth training on Mosaic's person-centered model. In addition, the team is backed with expertise in end-of-life care, bereavement, social work, nursing, and gerontology as well. So this is really a well-rounded, compassionate, empathic, multidisciplinary team that Mosaic is providing. So I'd like to start with Candace. Enough of my talking now. Let's pass you to the experts that work within Mosaic. So Candace, can you sort of give a brief overview of what you provide and your expertise as client services team lead? Thank you.
Thank you, Jane. The article titled Mosaic's Client Services Team in Action from our Fall 2024 newsletter gave an overview of our processes within the client services team here at Mosaic. Client services works to ensure our clients are met with a lasting impression, and it starts with the inquiry. When a caller needs in-home help for themselves or someone they know, client services is there to start the discovery process of the individual needing care. We take our time to discuss their concerns, we offer solutions on how we can help, and give them a general understanding of home healthcare systems. Sometimes this is the first time a caller is looking into home care, and they may have some questions, and we're here to provide that support. Callers tell us how appreciative they are of our time and assistance, and we also speak about how Mosaic is different and how we stand out in the community. If needed, we connect individuals to other organizations, products, or services they may find helpful. And during our assessment process, we identify the goal for the client and discover more details pertaining to their lifestyle, their background, their wants and needs, and in doing so, we obtain a fuller picture of the person. This information then helps us to create a care plan that is truly person-centered and specific to the individual. and it helps us make more informed decisions when it comes to caregiver selection.
Thanks, Candace. A great description. That gives a true sense of really, what you're providing and what the team is providing as a whole. So next, Martha Miller. Are you ready, Martha? Are you ready to go? Okay. Martha, can you describe some key points with regards to home care and person-centered care? And what differentiates us from other home care agencies?
Well, there's many ways that we stand out in our industry. Our assessment process starts by getting to know the client on a social and emotional level. What are the activities that they like to do? What did they used to like to do? Where did they work? Did they volunteer? What kind of goals do they have for themselves now that they have some extra support in their home? And what matters to them? We need to take the time to listen to what is important to them, what goals they have to work on with the caregiver there. Some assessments include many participants, so we get a really good understanding of that client's life's journey. We recognize that medical challenges are as important to note, but if our care team are focusing on person-centered care and building relationships, the hobbies and the interests are equally important to build those connections. Caregivers will be doing so much more than just tasks. They will be companions and engaging in meaningful conversations. During our introduction process, we make sure the PSWs are fully equipped in providing person-centered care with the notes we've provided from the assessment. They use these notes to find conversation pieces to help break the ice, so to speak. Our team at Mosaic, frontline and office staff, are required to take a mandatory training course to learn about the value of person-centered care and how to execute it in every thread of our company. The training is extensive, and each participant leaves certified in Mosaic's unique model of care. While at a home visit, we ask for feedback on how to enrich the client's lives, whether it's connecting more out in the community, bringing in meaningful activities, or finding joy in a new hobby to do together. We like to know how the person-centered care approach is proving to be a positive experience. And upon receiving feedback on our surveys and testimonials, this comment shows up frequently. We focus on the whole person, promoting all areas of their well-being.
Thank you, Martha. And I wanted to quote, just a couple of things that one of the research documents that we reviewed when we were starting a person-centered care model. I mean, we looked at a lot of academic work, a lot of work that the European Society for Person-Centered Healthcare. We reviewed many home care private agencies. And one of the things is that according to the UK Social Care Institute for Excellence, people who use services feel that carers do not motivate them to take part in activities or communicate with other people. So it's really transactional. It's like PSW going in, they know their duties on personal care, but the main part of it about the person as a whole, they're not getting that information. This is something Mosaic is amazingly great at, from the point of the assessment, the inquiry, the information that our client services collect, and that goes down to Martha Miller as well, that ongoing conversation about how it is person-centered, our meaning of me model, which is really important as well. I guess our person-centered care model and framework, the meaning of me, was drawn from an inspiration from the Joseph Rowntree report, A Better Life, What Older People with High Support Needs Value. The meaning of me addresses the needs of the individual outside of the home care model. So outside of the usual personal supports is what we're talking about, and develops a framework in which the caregiver, the client, the family, and client, and the wider community and client can establish a richer set of conversations, relationships, connections, community connections. The meaning of me is a journey for the client, for the individual, to reconnect with themselves, their interests, and where possible, their communities. And really, the meaning of me model is comprised of really 5 layers that we're looking at within our model. A non-clinical interface to generate knowledge and meaningful engagement with the person, a framework to support interests, activities, follow through, and feedback loops, opportunity for community interaction and connection. So this is important as well. It's not just about keeping the client at home and having the PSW go in. It's about connecting them to the community, finding out their interests and hobbies, finding out what's happening in that community, and making that social connection with them. It's looking at our embedded organizational process and culture, an emergent, wider supporting community architecture, and higher levels of integration across the public and private sectors. Mosaic Home Care also received an award of the Gold Medal for Excellence in Person-Centered Care of the Society at the 4th Annual Conference and Award Ceremony held at Westminster on October 26th and 27th in 2017 for our work here in Toronto on person-centered care. So this isn't something that Mosaic has just started because the buzzword is person-centered care or family-centered care or whatever. We have been working on this since 2017. And now you're seeing more community organizations implementing person-centered care or using it as a buzzword. But I'm interested in seeing those organizations that have actually added it with their framework and an integrated model as well, because that's important. I'm going to move on to Diane now, who will discuss her expertise on the end-of-life care, communicating with families, clients, and providing support to our frontline teams with concerns they may have. And Diane, she's done amazingly well. She has such a soft-spoken, calming voice, when she's talking to our personal support workers. Families have commented, other health professionals have commented on her as well. So we're going to hear from Diane. Thank you, Diane.
The end of someone's life is a profound part of their story. During this time, we work to ensure that the phrase, "you are you until the end of your life," is the center of the emotional and spiritual care we provide to the client. Working in cooperation with families and other care partners, our goal is to provide care and comfort to our client as an individual who is unique and has a story. The key here is an effective communication, which involves active and compassionate listening, starting with the intake and assessment conversations. Even where a person's wishes are carefully outlined, we always apply empathy to the discussion, tapping into our professional and personal experiences to convey a genuine understanding of what the client and family are dealing with. Our practice is to regularly relay our observations of care to the family of our client and any updated instructions or feedback that they may have to the care team, so everyone is confident the person at the end of life is being treated with the utmost dignity, compassion, and respect we can provide. We also appreciate and understand that the end of life can be a stressful time to both families and caregivers. We are here to provide a safe place for those around the client who need a compassionate platform to discuss how they are navigating the changes to the person. We understand anticipatory grief that may be present in all who are involved in the care of an individual who is dying. All conversations that enter into a more personal level with us, be they families discussing their own feelings or caregivers needing to know they have a place to talk openly about their experiences, are treated as confidential. We also have extensive community resources we can offer those who might benefit from a specific support network. Our client base and frontline staff represent the diversity that is our service area in Toronto and New York region. There are many avenues that can be explored to meet the diverse and unique needs for support in a particular community.
Thank you, Diane. And I just want you to also describe what you will be focusing on in the training on the palliative care end-of-life workshop, a person-centered care approach. And also, Karen is also part of that collaborative training. But can you just give a few points on that? What you're sort of teaching in that group?
We're trying to teach confidence to the caregivers and the ability to reach out and empathize and relate to clients. The understanding that even when things are, they might be a little frightening, especially the physical changes. It can bring a lot of emotions and, am I doing this correctly? And understanding that they have a platform to have a discussion, to say this might seem frightening and it's not what I'm used to, but it's not, it's not something to worry about. The ability to understand what a DNR is, what an expected death in the household is, and how to respond to that based on the family's and the client's wishes. And really how to reach out to the person through the senses, through music and touch and scent, and just to let them know they're there. We've recently had a number of people who are at the end of life, and it's very moving to see the caregivers who actually attended these workshops use the tools and the resources and the ideas that were provided to them.
Oh, thank you for that description. And I think, that this is something that Mosaic offers. As you can hear, the voices of our client services team, they all bring a certain expertise to the table in helping families, in helping our frontline teams, in working together as a group and as a team at Mosaic. So, we appreciate all their expertise that they bring. And now, Karen, who is our client services nurse consultant, my question to you is, what expertise do you bring to Mosaic, and how do you interact with our clients, families, and our frontline team caregivers?
Yes, as you mentioned, Jane, I worked as PSW and as a nurse for several years in the community before moving to client services. I can say I have a unique connection with our caregivers. I've faced similar challenges, and because of that, I'm able to share my experiences and strategies with them in supporting clients with varying needs at different stages of their lives. I provide coaching to enhance their skills, and I also help them with problem solving and provide motivation, especially in dealing with difficult situations. Similarly, through my experiences, I give family a glimpse of how person-centered care is being implemented in their loved ones' everyday living. Mosaic Care is not only focused on providing physical care assistance, but also psychosocial support through adaptive, meaningful activities. I assist them in setting realistic goals and provide them with informed and practical solutions. With my nursing background, I continuously reassess, anticipate changes, and update the care plan based on feedback from caregivers, families, and home visits.
Thank you, Karen. And just another question. With regards to falls risk and complex care clients, what type of information do you think is necessary, when we're doing an assessment?
Well, there are many factors that increases the risk of falling in older populations. During assessments, I found out that there is a history of falls in the last 12 months, which predisposes a person to an increased risk of recurrent falls. Neuromuscular and vascular diseases, cognitive disorder, diabetes, vision impairment are just few of medical conditions that can put a person at greater risk. I also need to know if there is impairment in gait and mobility, which reduces the strength and endurance of a person. Lifestyle and living situations are also important. Even foot issue can increase the risk of falling. These are some of the information we need to create a falls prevention plan. I assist in family in reducing environmental risks, encouraged client in improving and maintaining mobility and independence. And I also assist in modifying activities to keep them safe at home and well out in the community.
Thank you, Karen. So Karen is also involved, as I said, on the end of life training with Diane, who had spoken a little bit about what they're providing in that workshop. Karen has also come out with me to different health events as well, which is important, to hear from the nurse as well. And also presentations to hospital staff as well. So we have a wonderful, well-rounded group at Mosaic as well, sort of focusing on all the disciplinary, expertise that we need to bring to the table. And lastly, Nikita, Allie, our client services family social work consultant. My question to you is, Nikita, can you explain why your role as a social worker is important within private home care agencies, such as Mosaic, and a bit about our elder care plus family counseling and navigation services, and how this works, and what type of services do we provide under this model?
Hi, Jane. Thank you. So, my role as a social worker within a private home care agency is beneficial as families and their loved ones use client services team as a sounding board. However, from a deeper approach, my role as a social worker in Mosaic is focused on assisting families with additional support on many levels, such as counseling sessions under Elder Care Plus, which is advantageous as it focuses on larger projects for families who are looking for additional oversights and supports. Projects ranging from discharge planning with hospitals to assistance in transitional services to long-term care. Mosaic Home Care works with hospitals and families to organize discharge planning and provide supports where needed. Families who are also living out of country can benefit from these services by connecting over Zoom and other methods to keep them in the loop and up to date. In addition, my work also involves connecting with other resources by attending the North York Elder Abuse Network and the Alzheimer's Care Partners meetings regularly to connect with other professions from the community to help families find additional supports outside of Mosaic, such as Behavioral Supports Ontario, by making recommendations and suggestions. It is also important in my role as a social worker to collaborate with the care team as well as Martha and Lauren on a community side to understand the person being connected to their community, looking outside that lens to keep them socially engaged, connecting them with other organizations as well as their families, and sometimes families may also benefit from community programs as well as their loved ones, listening to families to gather information and making recommendations, having a social worker within a home care agency, within a client services integrated team is beneficial. Together, we can make a difference.
Thank you, Nikita, for explaining your role at Mosaic. I'm just going to highlight a little bit about our Elder Care Plus service, which we have integrated within Mosaic. We've been doing this for a number of years now, and this is why we do have a social worker in providing this care navigation. And so our Elder Care Plus is a family counseling and navigation service are here to support your wider needs. And here are some examples. Some individuals may just need some additional resources or connection to other organizations, maybe retirement homes, social programs, or community agencies. Other individuals and families may need higher level supports. And this is where Nikita would come in. She can, and also Karen as well, can attend meetings at discharge within hospitals before the client goes home. And we found that this was really important, especially if families are using private home care agencies. So we have a better understanding of what is needed when that person is going home. It could be exercises that they're doing, the medications that they're taking. Maybe there's other supports that are needing to help. So the more information that we get as a team, the better we can work and the better services that we can provide to the family and also to obviously the client that is receiving the services. Provide more detailed reports to the families if they're not living in the same city. So those people, we're getting a lot of people that, families are living in other parts of the world, in New York, in Australia, in England, all over, and the client or their family member might be here. So perhaps we're having to send more detailed documents. And I don't just mean little paragraphs. We're having to really send very detailed reports to help the family so they know what is going on here and we can sort of work together because it's all like the family, the client, our client services team, our personal support workers work as one and to try and help that family member or that individual who is living here. Zoom calls to the family, reports to family members who have POA, power of attorney, to update them on changes with regards to care. Assist the family if they have decided to move their family member into a retirement or long-term care home. So we can definitely go with the family. If they're interested in looking at different places, there's lots of different retirement homes and different styles out there as well, and different locations. Some are walkable areas. A lot of them have different social programs within the retirement home as well. Some of them have memory floors, so we can certainly help you with that as well. We also link families to other supports such as Alzheimer's Society Toronto, Parkinson's, and other community-based organizations that will help the family and the client. Mosaic cannot do it all, and we work with a number of organizations that are helpful, that would be definitely a help and resource to the families. Connection to community programs, resources, and information. So we're really for that social prescribing and connecting people back out to the community. Isolation is a big problem within Toronto and Canada, around the world. So we need to know how to connect people within their community and to have the social network around of friends and families to help. And then one-on-one with the client and understanding their needs as a person. And that's really important, and understanding their interests and hobbies and likes and dislikes and what are their goals that they would like to achieve. And, we try and work with them to try and get them to that space. So thank you, Nikita, for all that and your role within Mosaic. I just have another question back to Candace. Where is Candace? There she is. One last question, Candace, about transitioning from either hospital to home, hospital to retirement, or going into long-term care, or even bedside sitting in the hospitals. As we know, staff are pushed to the max. They may not have the time to provide that one-on-one care. So definitely Mosaic can provide that. And we also want to make it easier for the family too on that transition. And also easy for the client if they're having to move from their home into a retirement home or retirement home into long-term care. How nice is it to have the same caregiver going there until that person is transitioned? Or just providing that additional care to help the essential care partner as well. So can you talk a little bit about that, Candy?
As part of our person-centered approach, we adapt as care needs change. And we conduct home visits to do a visual check-in and ensure the care plan is up to date. We can also help with the transition period from home to retirement home or long-term care. And that would involve extending our services as the client moves into their new home, so they have some familiarity and comfortability while getting adjusted to their new environment. While our caregivers are there, they can also train or guide the staff of the retirement home or long-term care home to ensure the intricacies of care continue. And our caregivers can help to familiarize the client with their surroundings and help to connect them to the amenities and social programs within the home.
Thanks, Candace. And we do have a website as well. So that's mosaichomecare.com. And definitely all our information on our services, supports, social work, elder care plus services, our social events can be found on our website as well. And, you can always give a call to these wonderful people, that do work at Mosaic, that are very expertise in what they provide. So we are finally coming to the end of our podcast today. And I just want to thank, our truly amazing client services team. It's just so lovely to have you on the podcast and to talk about your role at Mosaic. And that's, I think it's crucial in people really understanding that we're not just a box type home care, that, we really care about the community and do a lot of things, in the community to create change and to really look at things that need to be changed within the private home care sector as well. So I think they're doing an amazing job each and every day, It takes a lot out of them. They're having to listen to our families. They're having to be patient. They're having to be compassionate. They're having to provide empathy. They're having to know about the resources within the community to connect the families to or the client to. So really hats off to the Mosaic team. I just like to say that. Before we leave the podcast today, I would like to ask each of our client services team to leave us with a takeaway message for our listeners. So we're going to start with Candace. So if you can provide us with your takeaway message, Candace.
Well, Mosaic stands out in different ways. Our multidisciplinary approach and extensive experience and person-centered mindset is part of what makes us different. And these attributes influence the way we operate in client services to deliver optimal care.
Thank you so much. And Martha, where are you, Martha Miller?
I am here.
Okay. And so what is your takeaway message?
We receive calls. People are overwhelmed. Suddenly something has happened to a family member or loved one, and they don't have any idea where to turn. They don't know how to ask for help, who needs to be involved, what the next steps are, and so on. So our team will help ease the pressure and show them that they're in trusting hands with us. We'll listen as they share information on what care is needed and the next steps for a smooth transition. We often hear feedback from our callers that there was a sense of relief after calling us and a feeling of calmness that we took charge and helped them with the process of getting home care.
Thank you, Martha. And also, for listeners or anybody wanting to look at our website, you will see testimonials. There's quite a number of them from the community, from clients, from families, from professionals. So do have a look and really, hear from the people that have used our services. We can talk until we're blue in the face, how wonderful we are and the things that we do, but it's really coming from the people that have used our services. And so we're very thankful for, everyone that's involved within Mosaic as well. Now, Diane, to you, what is your takeaway message?
Well, we genuinely care about each individual who calls us and are here to help. Know that we will listen to you, understand your situation, and work with you to provide genuine and compassionate support no matter what the circumstances.
Thank you, Diane. And now to Karen, what is your message?
At Mosaic, we recognize that navigating the challenges brought by a disease or even normal processes, aging process can be stressful and consuming for the family and the person. There are different resources available for you and for your loved ones. At Mosaic, we work with the clients and families for a seamless transition from independent living to needing companionship, day-to-day assistance, and palliative care at the end of life.
Thank you. Thanks, Karen. And lastly, Nikita, what is your takeaway message?
Mosaic Client Service Team can always make appropriate recommendations for families and their loved ones. We navigate through the social, emotional, and spiritual model, not just the medical lens. By taking a person-centered approach, we can make the best recommendations for you and your loved ones.
Well, thank you. Thank you all for coming online today. I really appreciate all your insight and your work in putting this podcast together, and hopefully people have a better understanding that it's not just Jane or Natalie that is running, but there is a whole team of staff behind us, that are just incredible individuals. So I'm very happy to have the staff that we have. I would also like to thank, thank you. I would also like to thank our listeners for coming on our podcast today, Mosaic's Community Life Podcast, Life in Canada. This is Jane Teasdale signing off, and stay tuned for our next podcast in 2025. Thank you.